about what you do. Non-members, it's $100, and that is including the $25 gift card. Next, we will see what BWC has to share. Ben Hissam, he is here at every meeting, or most every meeting. We always have at least somebody here from the BWC with lots of things to tell us.
Okay, well, thank you, Christy. Welcome, everyone, to the January meeting. What I wanted to share with you today is a little bit about what BWC is going to be offering here. Pretty much everybody's familiar with the Ohio Safety Congress. It is now open for registration. It will be virtual again this year, as it was last year, but at least this time we were planning to have it virtually. It wasn't that a couple of days that we had to scramble and try to get everything together. So the registration is open. It is March 10th and 11th. Registration's free. There'll be a few breakouts. Let me see what else we have here. There'll be an online expo, which you will have different vendors to be able to access online, educational sessions, a new product showcase, scavenger hunt, BWC rating program for credit, and you'll be getting CEU credits as you would need. So let me also share one other thing here. Just have to pull it up. That is what's upcoming as far as distance learning. We had a webinar yesterday, which I did, hazardous materials, if you are a hazmat employer, but we will also be doing others. Webinar coming up. If you are part of the Accident Drug-Free Work Program, one of the big things is your annual requirement for accident analysis. So they put a special one in February 9th. So that is 11 a.m. to 12 p.m. You will be getting CEU credits for that. So that will count for your required training for your accident analysis and drug-free safety program. There will be another one, office ergonomics tips for teleworkers in February. So they're actually doing two in February. We usually do one a month. Some of the virtual training classes that are up and coming are NFPA 70E in February. Job safety analysis, that's a half-day version of that. OSHA record keeping. Lockout tagout, which I will be helping out with February 23rd. That is a 4-hour version of that. And HAZCOM half-day workshop on February 25th. So there are a lot of good classes that are virtual. We're doing all our virtual training, and our online e-courses are also on demand, which you can register there at the BWC Learning Center website. So with that, I am all set, and thank you very much.
Thank you. You got me perplexed. How are they going to do a scavenger hunt virtually? I guess they'll tell you to go run and find something in the office or house. I don't know. That should be fun.
Yeah, probably some pictures or something you'll have to go dig up, I guess.
Yeah. All right. With that, we'll get right to our speaker, Dr. Linda Gutierrez. I want to make sure I said that correctly. We are so happy to have her here today. She's a clinical pharmacist and certified diabetes care and education specialist at Centerpoint Health in Middletown and Franklin. She also works as staff as a pharmacist at St. Vincent de Paul Charitable Pharmacy in Cincinnati, Ohio. Before moving to Ohio, she worked as a pharmacist and diabetes educator in Santo Domingo Native American Reservation in New Mexico. Board certified pharmacologist, or pharmacology, how do I say that?
Pharmacotherapy specialist.
All right, thank you. And she obtained her Doctor of Pharmacy degree from University of New Mexico College of Pharmacy and Bachelor of Arts degree in Psychology from Williams College. She enjoys hiking with her husband Jonathan and dogs, Cody and Storm. I like those names, Cody and Storm. So without, I know, comorbidity and COVID has all come to mind, and these are things we want to prevent, we think just for that reason, but now we have a whole other reason we want to be healthier. But there you go. Thanks for coming, and we can't wait to learn what you have to tell us.
Great. So thank you so much for joining to learn about diabetes. So I am Dr. Linda Gutierrez. So I am a clinical pharmacist, and at Centerpoint Health here, I manage patients with diabetes. So I have an agreement with providers. So I prescribe medications, adjust medications, as well as order labs. And then I also provide education to our patients one-on-one, over the phone, or through telehealth. So after this presentation, I hope that you will be able to describe direct and indirect costs of having diabetes, be able to explain what is diabetes and what causes it, recognize the signs and symptoms of diabetes, understand long-term complications of diabetes, learn how to diagnose diabetes, understand how it's treated, and know how to prevent diabetes and be able to find a diabetes prevention program in your area. So I'm starting off with a poll question. So if you could text your response, I have the number on the top. It's 747-998-0311, or you can go to swiftpolling.com and enter 22137. So the question is, what was the total diabetes cost in 2017 in the US? So you can text 1 if it's, text 1 if you believe I cut off 108 million, or text 2 if you think it was 327 billion, text 3 if it's 582 million, and text 4 if you think it's 16 billion. So I'll leave it there for a couple more seconds. So I see you guys think it's either 108 million or 582 million. The correct answer is actually 327 billion. Go back to my slides. So yeah, so the total cost of diabetes in the US in 2017 was $327 billion. And that includes direct costs like medical care and indirect costs like not being able to go to work. And so this value actually increased 26% from 245 billion in 2012. So the 223 billion is in direct medical costs and 90 billion in reduced productivity. So the largest components of medical cost are being in the hospital, so hospital inpatient care, prescription medications cost to treat complications of diabetes, and also the prescription medications of diabetes can be very expensive. Insulin can be hundreds of dollars, and some of the newer diabetes medications could also be hundreds of dollars. So it could be very pricey, as well as there are costs with anti-diabetic agents and diabetic supplies. So this includes diabetic meters or monitors used to test blood sugar, and test strips and Lantus, all the supplies needed to test your blood sugar. And then this medical cost also included physician office visits. So for the indirect costs, this included increased absenteeism, reduced productivity while at work for the employed population, reduced productivity for those not in the labor force, inability to work as a result of disease-related disability, lost productive capacity due to early mortality. So a person with diagnosed diabetes has average medical costs of $16,752 per year, of which about $9,601 is related to diabetes. And then a person with diagnosed diabetes has medical costs approximately 2.3 times higher than what costs would be in the absence of diabetes. So it's very, very costly. And in 2020, there were 34.2 million Americans, just over 1 in 10 that had diabetes. And for those that have diabetes, 1 in 5 don't know they have it. So what is diabetes? So diabetes is like a chronic disease that causes higher than normal blood sugar levels. When we eat food, it gets broken down into sugar, also called glucose, and the sugar normally goes into our cells for energy. However, for people with diabetes, the sugar has problems going into the cells, staying in the bloodstream, causing high glucose blood levels. And what allows the glucose to go into the cells is insulin. So diabetes develops when one of two things happen. The pancreas does not produce any or enough insulin, or the body does not respond well to insulin. And this is a diagram that shows you how insulin is like a key. So if the key fits in well, then the glucose will go into the cell. And so, but however, with insulin resistance, and this is a case with a lot of patients who have type 2 diabetes, the key doesn't fit very well. It might be like kind of rusty, or it doesn't fit quite well in. And so the glucose isn't able to go inside the cell because the key doesn't fit quite well. There are three main types of diabetes. So in type 1 diabetes, the pancreas produces no insulin. So in this type of diabetes, you need to give patients insulin. So there's no key. So glucose can't get into the cells without insulin. And type 1 diabetes is an autoimmune disease in which the immune system destroys cells that produce insulin. And about 5% of all diabetics have type 1 diabetes. In type 2 diabetes, the pancreas doesn't make enough insulin, or the body can't use it effectively. So this is where you see that insulin resistance. The pancreas might be making insulin, or the key is not working quite right. And so this diabetes type 2 is the most common. So this is about 90 to 95% of people with all diabetes. And we also have gestational diabetes, and this occurs in 2 to 10% of pregnancies. Expectant mothers are unable to make and use all of the insulin they need during pregnancy. So what are the symptoms of diabetes or high blood glucose? So we can see people might have frequent urination, and that's because an attempt from the body to get rid of that excess sugar. So you might have to pee a lot because your body's, you have too much sugar in your blood and your body wants to get rid of it. So you might be peeing a lot. And with peeing a lot, you might just be thirsty because you're losing a lot of fluids. You could also be really hungry because those cells are not able to get that sugar or energy. So you're really hungry, you need your energy. And this could also leave you to feel weak. Also, not being able to get the glucose into cells, the body looks for other ways to get that energy so we can start breaking down muscle or fat. So you might have some weight loss. You can also have blurred vision, and sometimes in diabetes, the lens of the eye can absorb water and swell up, so you can get blurred vision. You could also have nausea. There could also be notice slow healing of cuts or bruises. Diabetes affects the immune system as well. And then you could also see tingling in your hands or tingling in the feet. In diabetes, the sugar molecules are pretty big, and so they can do damage to some of the nerves as well, causing tingling. So how do you find out if you have diabetes? Well, you would need to confirm it with a lab test. So you would need to go to your provider, and they could do different types of lab tests to confirm the diagnosis. They could take fasting blood glucose. So this is a blood glucose of when you haven't eaten for at least 8 hours. So it's fasting. So if it's 126 or higher, that could indicate diabetes. And then there's also another test called hemoglobin A1C, and that measures your average blood glucose over the last 2 to 3 months. So if it's 6.5% or higher, that could also indicate diabetes, and that percentage, it corresponds to a blood sugar level. So 6.5% is a blood sugar around 140. And then also there's another test called the oral glucose tolerance test, in which you would drink 75 grams of sugar, and then they would test your blood sugar 2 hours later. And so if that number is higher, your blood glucose is higher than 200 milligrams per deciliter, then that could also indicate diabetes. In a patient who has a lot of symptoms and they just test their blood sugar at any random time, fasting or not fasting, and their blood sugar is over 200, then that can also indicate diabetes. So if a patient has symptoms of diabetes, only one test is needed, but if they don't have any of the symptoms, then you need to have at least 2 tests to confirm the diagnosis. And so why is it important that you find out if you have diabetes? This is to prevent diabetes long-term complications. They don't develop instantly. They take like years to develop, like 5 or 10 years to develop. So the earliest you find about diabetes, the better. You can control your blood sugars, and this will help prevent long-term complications. So diabetes, you're in increased risk for developing strokes. You're also an increased risk for developing heart attacks, coronary heart disease, and also peripheral vascular disease, and that results of narrowing, that is the narrowing of the blood vessels, increasing the risk for reduced or lack of blood flow in legs. And this also can lead to a slowing healing time of wounds as well. Diabetes can affect your eyes, so you can damage some of the blood vessels. The blood vessels are pretty tiny in the eye, and it could do damage causing retinopathy, or it can also cause cataracts or glaucoma. It can also affect the kidneys as well, because there's also small blood vessels in the kidneys, and so it could do damage. Patients with several years of diabetes, their kidneys can get damaged, and eventually their kidneys might not work anymore, and they would have to go on dialysis. It can also affect the nerves, like I said earlier, because of the sugar molecules are pretty big, and so they can damage the nerves. So you can get tingling, especially in your hands or in your feet. And also, people with diabetes experience higher rates of mental health issues. So there are increased symptoms of depression that affect 1 in 4 adults with diabetes, with rates ranging from 21.3% in adults with type 1 diabetes to 27% adults with type 2 diabetes. 18 to 45% of people with diabetes exhibit diabetes distress, a condition where the emotional burden and stresses of living with diabetes manifest in physical ways such as fatigue, tension, and burnout. Adults with diabetes have been found to have elevated rates of anxiety symptoms and conditions, including generalized anxiety disorder and anxiety symptoms that are specific to the experience of living with diabetes or diabetes complications. I also wanted to include a slide about COVID-19 and diabetes. So those with diabetes are at an increased risk of severe illness from COVID-19. Having diabetes does not increase your risk of getting COVID-19. However, you're more likely to have more severe symptoms. A study looking at 44,672 patients in China found that mortality rate for people with diabetes was at 7.3% compared with the overall mortality rate of 2.3%. So in addition to severe symptoms, patients are more likely to die as well. And in the US, looking at 7,162 patients, 24% of people hospitalized, but not in intensive care, and 32% of patients in the intensive care unit had diabetes. So were also higher percentages. So if you had diabetes and you got COVID, you're more likely to be in the hospital or be in the intensive care unit. And why does this happen? Because high blood glucose, it weakens the immune system. So how is diabetes treated? Well, it depends on the type of diabetes. For type 1, you need insulin because your pancreas doesn't make any insulin. But for type 2 diabetes, there's several different options. I tell my type 2 diabetics that lifestyle is really important, diet and exercise. I tell them that diet is kind of like the main superhero or the Batman, and the medications are like the Robin or the sidekick. So I will, in a future slide, I will go more into the diet and exercise. So for type 2 diabetics, most of them can use oral medications. So there are several different medications, some of them allow one's body's insulin to work better and enter cells, so they help out with that insulin resistant. There's medications that stop the liver from making too much sugar at night, especially. Our liver is making sugar just to help support everyday functions. And so those oral medications tell the liver to not make as much sugar. There's also medications that will make you pee out extra sugar as well. And there's a newer medication right now, actually, that is an oral that sends a signal to your brain and tells your brain that you're full, and it slows down emptying of food from your stomach. So patients tend not to eat as much, and patients tend to lose weight. And that medication also is also available as an injectable, as a daily or once weekly injectable. And there's other oral medications that cause the body to release insulin, and then from the pancreas. And then finally we have insulin. There are different types of insulin. There's long-acting insulin that lasts like over or 24 hours or over. We have rapid-acting insulin. It only lasts a couple hours, and it starts working within 15 minutes, or short-acting insulin. It starts working within 30 minutes. It lasts a couple hours. Intermediate acting, it lasts about 12 hours. And then we also have mixed insulin, so we can combine like an intermediate with a short-acting as well. So with insulin, especially, I know patients might have a risk of getting too low blood sugar, and sometimes they might inject too much insulin or not at the right time too. So they're at risk of getting a low blood sugar, and the symptoms for that, or you can become shaky, you can become sweaty, your heart can also start racing faster, you can become dizzy, you can be confused and have a difficult time speaking, or you can become hungry, weak or tired, or have a headache, or be nervous or upset. So what do you do if somebody has low blood sugar? So there's a rule called the 15-15 rule. So you want to check the blood sugar. So if it's below 70, that's where we want to take action. So 70 is the number. So if it's below 70, you want to eat 15 grams of carbohydrates. And then you want to wait 15 minutes later and test your blood sugar again. And it should be above 70. If it's not, then we would eat another 15 grams of carbohydrates. And so what is 15 grams of carbohydrates? So half a banana, half a cup of orange juice, 1 tablespoon of sugar or honey, 4 to 5 saltine crackers, 3 to 4 glucose tablets, half a cup of oatmeal, 1 slice of bread, a small piece of fruit. It could also be half a can of regular soda. So not diet soda, but regular soda. And so with diabetes, especially type 2, diet is really, really essential. So this is the diabetic plate method recommended by the Centers for Disease Control and Prevention. So it's recommended to eat half of your meal be non-starchy vegetables. So when you fill your plate, it's recommended to fill half with non-starchy vegetables, and then fill 1/4 with whole grains or starchy vegetables, and then fill another 1/4 with lean protein like chicken or with like fish. And then it's also recommended to eat a small amount of fresh fruit. And then also you can drink 1% milk or skim milk. When you're choosing dairy, it's really important to choose like non-fat or low in fat, because dairy can have, some dairy products can have quite a bit of fat. And for exercise, for people with diabetes, it's recommended 150 minutes of aerobic exercise per week. And you don't have to do it all at once. You can break it down. So I like this diagram. It's like one day you can do 10 minutes of vacuuming, and then maybe later that day, if you want, you can do 15 minutes of stair climbing. Another day, you could do 30 minutes of brisk walking. Then you could you do another, like play soccer or bike or use elliptical, as long as your total week's exercise is 150 minutes. That's the recommendation. And strength training is also recommended. So adults with diabetes should engage in 2 to 3 sessions a week of resistance exercising or strength training on non-consecutive days. And then, especially for older parents or patients or older people, flexibility training and balance training is also recommended 2 to 3 times a week. So yoga and Tai Chi are great examples of exercises that provide this flexibility and balance training. And also it's just recommended as well for type 2 diabetics that you don't sit around or lay down for a long time, that you at least get up every 30 minutes. And then I also wanted to talk about diabetes prevention. So prediabetes is a health condition where blood glucose levels are higher than normal, but not high enough to be diagnosed with diabetes. There are 88 million American adults, approximately 1 in 3, that have diabetes. Of those with prediabetes, more than 84% don't know they have it. And so what you can do to see if you have it, or if you think, to see like, what are my chances of having prediabetes, there is a screening test or a questionnaire on the CDC website. I included the link. There's 7 questions that you can answer, and each question they attach a point system. So on that site, they can actually calculate it for you. But those questions are about your family history. So your increased risk of having prediabetes if you're or if your sister, brother, or parent have had diabetes, or the older you are, you also increase your risk of having prediabetes. And then if you're a woman who has had a baby weighing more than 9 pounds at birth, that also increases your risk of having prediabetes. So after you answer the questions and calculate your score, on this website also gives you instructions what to do. So if it's 9 or higher, it is recommended that you go to a doctor, and then they could do a lab test to see if you have prediabetes or not. And so I have another polling question on that. So if I am pre-diabetic, what can most reduce my chances of getting diabetes? So you can text 1 to that number if you think it's diet and exercise, text 2 if you think it's medication, or text 3 if you think nothing, that you think if you have pre-diabetes, you're able to get diabetes anyways. So I'll leave that up for a couple seconds. Okay, and you guys were right, yes. So it's diet and exercise. So yeah, so there's actually a study done called the Diabetes Prevention Study, and it looked at diet and exercise. It also looked at using a medication called metformin. Metformin is an oral medication, and what it does is it helps increase the insulin sensitivity, so it helps the key or insulin work better, so the glucose can get into the cells. It also stops the liver from making too much sugar as well. And then they also looked at, in addition to patients without any treatment at all. So they found that there was 58% reduction in developing diabetes in those patients who incorporated the diet and exercise. And here the exercises was they exercised for 30 minutes a day. And they also found that there was a 5 to 7% reduction in body weight. So there's a 58% reduction in developing diabetes over a 3-year follow-up period. And they found that there was a 31% reduction when using that oral medication, metformin. And so I wanted to let you guys know that there's diabetes prevention programs in every state. And a lot of the time, insurance companies will cover it. So you can go to the CDC website, enter your zip code, and you could find a diabetes prevention program near you. And they're very, if the insurance doesn't cover it, a lot of the programs are very low cost. So I did look up diabetes prevention programs in this area. So there is the YMCA of Greater Dayton. Actually, we send patients from Centerpoint Health to work with them. They have I know that this program, they have, well, actually all programs, they have a life coach who gives education about diet and exercise. And right now, because of COVID, they have online classes. There's also another diabetes prevention program, the YMCA of Greater Cincinnati, also YEP Fitness in Cincinnati, Tri-Health Rehabilitation Hospital in in Cincinnati as well. And then Kettering Health Network has a diabetes prevention program in Centerville. So in summary, I wanted to leave with these points. The cost of diabetes is high. There are many complications associated with diabetes. It's important to try to prevent diabetes from happening. So if we are pre-diabetic, it's good that we enter or participate in a diabetes prevention program. And it's important to aim for a healthy lifestyle. Like, again, diet, exercise is key, is really important. And that's all I had for my presentation.
Ben, you going to field questions? I know we had, and you kind of answered it about whether we can, if you have it, can you reverse it?
Reverse it. So a lot of time, usually it's like a life diagnosis, but if you can get rid of medication. I know a lot of my diabetic patients who have changed their lifestyle, they've been able to get off their medication and control with nutrition and exercise. So so they have controlled diabetes. Yeah, and sometimes too, when people, there's some surgeries like gastric bypass as well, and patients lose a lot of weight after those surgeries as well. They don't rely on medication.
Most of the people on here, probably all of them, are looking through the lens of employers, and I was just thinking, you know, employers know which employees are diabetic so that they would kind of be alert if they started showing those signs of having low blood sugar and what to do. And I just wonder if any of them have little sweet treat or something on hand, specifically if they know they have someone so they can quickly grab it. And I have a question, because I remember one time we had someone doing some work at the house and they started, you know, we knew them a little bit personally and knew they were diabetic, but they were exhibiting signs. So we went and got them some orange juice. But can you give, you know, it has specific amounts, a half a cup of this. What would happen if someone wasn't aware and like said, here, drink this whole pop or something like that?
Yeah, I think their just sugar would go up higher, but it would still help with help cure their help with their
I always worry about that.
They would get like a higher amount of sugar, but they say at least 15 grams, because if it's lower than 15 grams, their sugar might not be raised enough. So yeah.
So a diabetic coma would be that their blood sugar just got so low that they went into a coma. Is that?
Oh yeah. So sometimes that's like if your blood sugar goes in less than, you can become unconscious. So like less than like 50 or 50, 55, you can become unconscious. And those patients do have a history of that. They should have a glucagon pen. So there's an injection that that you can get to rate. Yeah, they would be unconscious and they couldn't eat. They wouldn't be able to eat sugar.
Okay. Anybody else have any questions? Nobody's typing in. You did such a job that we know. Hey, if you guys can type in, are you aware at the work site of your employees that are diabetic? Or is that a HIPAA thing? Like, I would want to know if I had, you know, a bunch of people working on a line at a factory or something, that, you know, just so you would be aware of if they started acting a little different, or, you know, I don't know. Is that a HIPAA thing that you wouldn't be able to know if they were diabetic as an employer?
Yeah, I mean that is, I guess, unless they shared it with their employer. I'm not sure it's like required to tell them.
Just something to think about, or just to have on hand as an employer. There was another question. How does it affect minority over the general population?
So minorities have a higher percentage of diabetes. So like Native Americans, Latinos, and African Americans, there's a higher percentage of diabetics compared to white people. It affects them more. There's a great.
Anybody else before we call it a day? And the winner gets a $25 Amazon gift card. So we'll announce that and send an email probably tomorrow. Doesn't look like we have any more questions. Appreciate your time
You're welcome.
and the information. And we'll see folks next month. Let's see, next month's meeting is mental health first aid. And we all will learn something there, I think. The Mental Health and Addiction Services Board, someone from there will be presenting. So appreciate everybody coming. Have a great rest of the month, and we'll see you in February.
Great.
Bye.
Thank you. Bye.